Wearing a mask will help, but it is no substitute for keeping apart from others and washing your hands. People who have had a test for COVID but don't yet know the results should stay in quarantine until they get the result. Assume that you are contagious until you get a negative test result. Earlier today, Governor Noem announced that her new executive order changes the shoulds from her previous executive order to shalls for following the CDC guidelines. And those in Minnehaha and Lincoln counties who are 65 and older or have chronic medical conditions must stay home for 3 weeks. She will list the applicable medical conditions, but they include certain lung, heart, and kidney diseases, diabetes, and more. This does not apply here in Cottington County, but it is certainly a good idea, and I urge all of the vulnerable people in our community to stay home. Everyone, regardless of age or health, should limit the trips that they take outside of their home. Only take necessary trips. I would like to thank Terex and the CFO, Alan Stager, for initiating and getting our business volunteer group up and running. This group includes those making masks and gowns, and we'll hear a little bit more about that today. The group is growing daily. We are a strong town full of generous, caring people. We will weather this pandemic and come out stronger, smarter, and more loving people. May we never forget the lessons that we are now learning. One, we can maintain close connections through phone calls and video conferencing, and while keeping a physical distance from one another. Also, we are talented and innovative. Also, small gestures of kindness can have a big impact. We all matter, and we all have something to give. Uncertain times make us uncomfortable, but be assured this community has rallied together and has already made an impact to help flatten the curve. Protecting our supplies is part of why following recommendations is so important. So please lead by example and stay home as much as possible. More recommendations can be found on our Facebook page or at covid.sd.gov. And if you need assistance during these times, please visit helplincenter.org or call 211. And in the words of my friend Faith Struckman, who said it best, take care of and love others, buy local and American made, volunteer, and never give up. Thank you.
Thank you, Mayor. Casey DeBoer, President and CEO of Prairie Lakes Healthcare System in Watertown. I have a few things I want to talk with you about this afternoon. The first is just a few comments on the CDC's recommendations related to the wearing of cloth masks by the public when they are out in public. I want to read a statement from the American Hospital Association, the American Medical Association, and the American Nurses Association, and do that on behalf of all the healthcare providers in this community, because we think it's vitally important, the message that they wanted to convey. So the statement from those organizations was that given increased evidence that if infected individuals without symptoms can spread COVID-19, the CDC has put out important guidance to the public in the battle to reduce the spread of the disease. As organizations representing healthcare professionals and caregivers, we call on the public to be mindful of the needs to ensure N95 respirators and medical-grade surgical masks remain prioritized to your healthcare heroes, your doctors, nurses, and other frontline caregivers and workers. And please use non-medical reusable masks instead of these items as the CDC suggests. We all just urge you not to come seeking masks from the healthcare community. These are vital tools that we need now, and especially in the future as we go into a community surge related to COVID-19. And we appreciate the community's support of that. Additionally, on behalf of the other healthcare providers in the community, I also want to share how important it is for members of the public who have been tested or who are symptomatic to please share that information when they come to our facilities. We have had some examples of people coming and after they've been involved in care for a period of time saying, oh, by the way, I was tested last week. That puts your vital healthcare workers at risk, and we need every one of them to be present and at work to care for the community as we go into surge. So please be courteous, and remember, you have an obligation as well to share with us the information about what's going on with your health when you present to any of our organizations across the community. It is collaboration with those organizations in our community, as well as the other health systems in the state and the Department of Health, that's going to get us through this, because we're all working together as a team. The pandemic continues to shift on a daily basis. On Friday, we were given, all of us, the communities and the public, as well as the hospitals, good information from the state Department of Health based on their modeling on where they think the pandemic is going over the next few weeks. So the governor and the Secretary of Health talked about that we will peak as a state in our cases in mid-June. And that means that we're only 2 to 3 weeks away from a ramp-up period as we move towards that peak. Our working together with the Unified Task Force in the community, as well as the other systems and healthcare providers in the state, as I said before, is how we're going to get through that. It is a teamwork activity. We can't do this on our own. We are in constant communication with all of those folks, and we use that information then in our contingency planning at Prairie Lakes to determine how we're going to care for the number of patients that we believe we will be seeing, where we're going to care for them, who's going to care for them, and how we're going to do the best job possible for this community. And so just know that we're using this time to prepare to care for this community when the surge comes. And again, we're all in this together. These are very uncertain times. However, we're preparing the best we can to work together with you and all of the other healthcare providers, and your support during this time is very critical. And so please stay at home and follow the guidelines so that we can continue to flatten our curve so we see less patients that have to be hospitalized. Thank you very much.
Good afternoon. My name is Don Rowland with Watertown Fire Rescue, and I serve as the planning section chief with our incident command structure for the COVID-19 incident locally. First, I'd like to share what the incident command system is and how it works. The ICS is standardized, on-scene, all-hazard incident management concept. This concept allows users to adopt integrated organizational structure to match the complexities and demands of a single or multiple incident without being hindered by jurisdictional boundaries. The ICS system creates a better foundation of accountability, communication, integrates interagencies, and creates a planning process to mitigate the situation. The planning tool currently being used is the local pandemic plan that was created during the H1N1 pandemic in 2008-2009 range. While developing this plan, there were many experienced representatives from various stakeholders at those planning meetings to come up with a plan that would best be utilized during a possible pandemic outbreak in our community. Currently, the planning team is adjusting some of the areas of this Watertown COVID-19 local response. The COVID-19 pandemic plan is the tool that is being used to help create daily objectives, tactics, and strategies during this incident. The pandemic plan is fluid, so projections and recommendations can change every day in our community response. We have a unified command team in place, and they're all committed to their protection of their citizens. Here are some of the incident commanders that are on the unified command team. Up at the top up here, we have our unified commanders. Mayor Sarah Karen is with the City of Watertown. Casey DeBoer is with Prairie Lakes Healthcare System. Cindy Midland is with Sanford Clinic. Jim Vackel is with Brown Clinic. Chief Luke McPeak is our Watertown Police Department Chief. Chief Doug Kranz with Watertown Fire Rescue. And Sheriff Hall with Sheriff's Department. Their job is to lead the incident, set the objectives, approve the daily incident action plan, and approve all resource ordering. Under the unified command section, all four of these up here that I'm pointing to are the command staff positions. The safety officer, as you can see up there, is Dr. Dan Riefenberger and Dr. Bill Devine. Their responsibility is to advise on vital information concerning the public health of the incident to the incident commanders. We also have the public information officers, as you can see in today's briefing. Their job is to disseminate the important information to the community and the media. Captain Steve Rehorse Sergeant Nick Amon, and Jennifer Bender with Prairie Lakes Healthcare System are serving in this areas. Brenda Hanton is serving as our liaison officer as well as the mayor, and they're the point of contact to agency representatives such as federal, state, and local officials. We also have legal counsel officers up top there, and they are Matt Roby and Rebecca Reeves from the city and county and are serving respectively. The command staff reports directly to the unified commanders at the top. Under the command staff, we have section chiefs. As you can see, these are the 4 section chiefs right here, all the way across there. Operations section chief is right over here. That is a big job. That is served by Assistant Chief Tim Toomey. Tim's job is to direct and coordinate incident tactical operations. He's in charge of the 4 branches, as you can see below that, and they all report directly to him. Next is the planning section chief, which is right over here. The planning section chief is led by Battalion Chief Scott Youngblood and myself. Our job is to gather, analyze, and manage the planning process by completing the incident action plan weekly. We also provide situational updates to the task force and lead the operational period briefings. We have a logistics section chief, and that's a very important role. That's served by our County Emergency Management Director, Jamie Torstensen, and Dave Wagle from Prairie Lakes Healthcare System. Their job is, throughout the incident, is ordering and securing all types of resources, such as equipment, personnel, and many supplies needed during the incident. In addition, supplies are allocated through the state and federal government and are dispersed to the communities in the highest priority. Our supply inventory is constantly changing as the entire nation responds to this pandemic event. Lastly, on the right over here is the finance section. We need people to pay the bills, right? They're the finance section chiefs. The point of contact there is Kristen Bobzine from the city, Cindy Bruggeman from the county. They're responsible for administering all financial matters for the incident. Most of the tactical work is done daily in the operations section under the operations section chief, and they're the 4 branches that served respectively. As you can see over here, we have the 4 branches. This one over here is the public service branch, led by Captain Kirk Ellis. The healthcare branch is led by Shelley Turback, and she's with Prairie Lakes Healthcare System. We have the education branch over here, served by Mike Cartney, and then we have the volunteer branch, which is served by Joe Vitek. These individuals have many people that are reporting to them respectively. Each one of these branches have at least 3 to 7 groups or divisions underneath them respectively. Each week, these groups and division leaders hold meetings to identify situational updates for each team and any operation resource needs they're expecting during this incident. These groups and divisions are always looking forward and planning. Respectively, the branch directors have operational planning meetings with section chiefs to provide additional input. So, as you can see, this is a very complex incident command structure. They are working collectively as a unified team. All these people in the task force represent over 100 individuals possibly that are working in various positions throughout the COVID-19 response. The large task force team meets regularly via Microsoft Teams for operational period briefings to discuss situational updates, guidance, and federal and state officials, information, and also from our local leaders. In addition, the unified commanders are meeting daily at 1 p.m. for planning of this incident, as well as providing those updates to our daily press briefings at 3 p.m. As a planning section chief, I've been involved in numerous incidents throughout my career. This incident, because of the leadership of numerous dedicated members of the task force, are making a difference in preparation, planning, and responding to COVID-19 cases in our local area. The task force is a collective group of professional, committed, and brave individuals that are working very hard in this fight. And like the mayor said many times before, we will all get through this together as a community. Thank you.
Hello, my name is Kirk Ellis and I'm a captain with the Watertown Police Department. Currently I serve on the public service branch as their leader. One of the needs that came about in our meetings is that masks were possibly becoming a shortage with our healthcare professionals. Working with the healthcare branch, we developed a plan and put a plan together along with the business leaders underneath myself in the public service branch. So if you can see there on the screen, we're looking for anybody that can sew, that is able to sew or has the ability to do so, to produce some masks for the city of Watertown and the medical professionals within the city. These masks that people are going to produce will go directly into our facilities and put into good use right away. The pattern, as you can see there, is the pattern that is recommended by the public healthcare branch, which is the Olson mask pattern. It is a pattern that uses a pouch that goes over top of the N95 mask and allows them to be used again, the N95s, by protecting them. Any material can be used that's cotton or cotton blend that will allow to go over top of the mask. Once you've created the masks, you can drop them off at the Salvation Army there at 621 4th Street Southeast in Watertown, Monday through Friday, 9 to 5. They'll be happy to take the masks there, and then we'll get them distributed out through the logistics section. As Don just explained there, we'll get them to them, and then they'll go out to the various healthcare facilities. So friends and neighbors, help us out within the community. This is something that we do need. It is something that is going to go to good use immediately upon taking them in. So do what you can, and I appreciate the help.
Thank you, everyone, today. Mayor Karen, CEO DeBoer, Assistant Chief, Fire Chief Roland, and Captain Kirk Ellis. Thank you guys for speaking today. At this time, we'll open up to any questions from the media. Thank you, everyone, today. Mayor Karen, CEO DeBoer, Assistant Chief, Fire Chief.
Yes, go ahead.
Ellis, thank you guys for speaking today. At this time, we'll open up questions.
I can't hear the question. Could you repeat, please? Yes, go ahead. I can't hear anything. Are there other questions from any of the other media sources?
Mayor Karen, this is Mike at KWAT. Can you hear me okay?
I can hear you just fine, Mike. Thank you.
Okay, good. Thank you. On the beginning of the news conference, I was not getting an audio feed from the online video. I was able to hear it over the phone, though. Now I do have the online audio. I'm wondering if you could just repeat your statement at the beginning about the fact that Cottington County is now considered community spread, and maybe in your mind, and if Mr. DeBoer wouldn't mind coming up too, talk about how that changes things when it is spreading and we don't know why.
Sure. So we're now designated as a county that has community spread, which means that the cases cannot be traced to a source. And that probably means that someone in our community has the virus but no symptoms. And so when that happens, we are elevated a level, and it just becomes even more important for everyone to maintain that social distance. Don't go out if you don't have a necessary trip. Wash your hands, wash your hands, wash your hands. And it's even more important when we know that there is a source of COVID floating around that we haven't been able to identify. So there isn't a change in what we need to do. We just need to up our efforts to maintain social distance and stay home more. Casey, did you want to add to that?
Well, I would just comment that the changes we've made recently related to having no visitors at the hospital are in preparation for the status that we've now achieved, unfortunately, in the community. As we know, the disease is going to continue to progress in our community. Our staff are well prepared and vigilant. This allows them even more opportunity to be aware that anybody coming into the facility could potentially have the disease, and we're asking those questions. And that's why we ask that the public share with us if they've been tested in other settings. And so we're prepared and we're ready to deal with any patients that come to us and care for them appropriately.
Are there any other questions?
Share with us if they've been tested in other settings. And so it
Was that a question? Okay. Oh, okay. All right, do you want to?
All right, I'd like to thank everyone for joining us again. One thing I forgot to mention last week is the police department, we had received a donation of approximately 400 masks from Terex, and we're able to get those distributed to the clinics in Watertown, the Emergency Operations Center, as well as Watertown Fire Rescue. So thank you to those for donating that. Also, be looking for information on our Watertown COVID page, as well as it's on a couple other Watertown Facebook pages, the information on those homemade masks, the way to make them and where to drop them off at. So be looking for information there. At this time, we're going to end the meeting, and we'll see everyone tomorrow at 3.